If you need information about pancreatic cancer, you've come to the right place. Join us on the Healthy Reasonings podcast this week as we tackle this difficult but yet interesting topic, pancreatic cancer. Let's roll.
Welcome to the Healthy Reasonings podcast with Dr. Andre. You are now listening to your number one source for clear, unfiltered conversations about your health and wellness. Join us every Tuesday for success stories, educational topics, and interviews with wellness experts from around the world. You can listen to this podcast on your computer, phone, or any other electronic device that streams podcasts, or download each episode and listen to it on the go. Let's get started with today's episode.
All right, so many of you would have watched the episode that went before. That was episode 31, where we spoke about the gallbladder and how we do a gallbladder flush and why we do gallbladder flushes and the importance of the gallbladder. But you will also remember that I spoke a lot about the organ that was beside the gallbladder. And as a result of that, we were able to create a little competition for those of you watching on YouTube, also on Spotify and beyond. We created a little competition to see who could figure out what today's topic was going to be. And I traced out the organ that we're going to discuss. And lo and behold, it was the pancreas. So for those of you who guessed pancreas, that was right. And today I'm going to talk a little bit about what is pancreatic cancer. And weirdly, I'm going to share why I enjoy helping people with pancreatic cancer. Today's discussion is not going to be centered around all the details of how the pancreas works and everything in terms of how its anatomy and physiology and so on. No, we are healthy reasoners. And because we're healthy reasoners, we're talking about the critical information that we need to know to talk about cancer of this organ. And so if I don't share some bits of information, it's not because they are unimportant, but it's just that for the purposes of today's discussion, they're not helpful to the information that we want to bring across. Remember, the Healthy Reasonings podcast is your number one podcast for clear, unfiltered information about your health and wellness. However, we're not sharing information specific to you. So if, God forbid, you have a problem with the pancreas or another medical problem, please seek advice from your healthcare practitioner of choice or find one that you think might be helpful for you. Get in touch with them and ask for help. So let's jump right in. I'm going to go over to our diagram here. All right, good. So last week we spoke a lot about the gallbladder, which is here. And because we were speaking about the gallbladder, we made reference to the fact that the gallbladder empties first into something called the cystic duct. Here we see the common hepatic duct emptying here as well, meaning a duct emptying from the liver. And here we have the common bile duct. But this organ here, you'll notice that it's nestled, nicely tucked in between the curve of this part of the intestine, which is the duodenum. And this organ here is what we call the pancreas. Yeah. So the pancreas, loosely speaking, has three parts: a head, a body, and a tail. The body is somewhere around here. It has a tail. But I want you to look carefully at the fact that right at this point, the pancreatic duct comes into contact with the duct coming off the gallbladder. And ultimately, they both empty into an area called the ampulla vator. And so remember this, last week we spoke about the gallbladder and what it was emptying, which was bile. Let's talk a little bit this week about the pancreas and what it is adding to the equation. Now, I want to first make the point that the pancreas is what I call a very powerful organ. It's a very powerful organ because, first of all, it has two main functions, and these functions are both critical to the well-being of your body. The first function being what we call an endocrine function. Endocrine function, that's what the pancreas is probably most well known for, because it produces, amongst other hormones, two hormones called insulin and glucagon, which are critical for glucose metabolism, balancing your blood sugar, amongst other things. And so when people think of the pancreas, a lot of the times we'll think about the fact that the beta cells of the pancreas produce insulin, and everybody kind of knows this whole, urban legend of the fact that because when the beta cells are unable to produce enough insulin to meet the demands of the body, then that is a term that is usually referred to as diabetes. Good. So that's not much of a struggle. The exocrine part of the pancreas, though, is where I think a lot of the real raw power lies. And allow me the liberty, as somebody who's been treating conditions related to the pancreas for more than a decade, to just tell you how I feel about this organ. So the exocrine part of the pancreas produces very powerful enzymes, which classically are associated with the digestion of fat, carbohydrate, and protein that was first partially broken down in the mouth and also partially broken down in the stomach, which is up here, and then released out here into this part of the duodenum, where it kind of comes into a nice position for the pancreas and gallbladder to send out what they're sending to help with the digestion of the food. So we know the gallbladder produces bile, which has dual purposes, but the enzymes released by the pancreas are released into this point as well, and they help with the breakdown of the carbohydrate, the fat, and the protein, and along with them comes some amount of bicarbonate to help to neutralize some of the stomach acid, a little bit of water because it has to be liquid. And so all of that meets up here and has a nice little breakdown process going on of the various foods. But guess what? In order for these enzymes to be released, a couple of things need to happen first. One, the pancreas has to have a stockpile or a storage of these enzymes in a, let's say, an inactive form. So they're not yet ready for use. And the pancreas has a lot of this stored at any given time, ready to be activated. So once a signal is sent, usually from as early as the time when the food is being sent down from the after swallowing, the pancreas is already getting some information to say, hey, guess what? Something is coming. And so there's a whole cascade of events that takes place to help the enzymes to move from being inactivated or packaged up neatly, not yet ready for use, to being unpackaged, mixed up as they should be, and released into this area here so they can help to start digesting the food. And an enzyme really is a substance that helps a chemical reaction to go faster. So an enzyme in this case would help the breakdown of carbohydrates and fats and proteins to go faster. And as a result of that, the pancreas becomes critically important for the digestion of food. But that's not all. Imagine that. It's also critically important because these digestive enzymes also play critical roles in the general housekeeping of the body, especially within the bloodstream. So science has demonstrated to us that these enzymes, if they're not all used for digestion of food, they are absorbed through the walls of the intestine, and they get into the bloodstream. I don't think we're 100% clear on how they're allowed in, but they are. And as a result of that, they are very helpful for keeping the bloodstream clean, helping to participate sometimes in inflammatory reactions and repair and breakdown of different things that need not be in the bloodstream, generally keeping the highways clear, doing some cleanup. And so what that means then is that this small organ, relatively small organ, nestled in a critical place within your abdomen, does a lot of work potentially for the vitality of your body because it's involved in breaking down fats, carbohydrates, and proteins so that you can get energy in the first place. 2, it's insulin and glucagon balance out your glucose, your sugar metabolism. That's also critical for your good function. And then, as I mentioned before, it's powerful because it has to keep these stuff tightly stored away and ready for use when necessary. So in a way, it's like a powerhouse of potential tools and weapons and so on needed, but it's just sitting there, nestled within the intestine, ready to go when you're ready. And you see the shape of it as well. So some of the stuff has to be transported from all the way here to all the way out here. And so it's a nice, I like to think of it as a nice commander of the troops, sitting right in there, getting ready to do its work. So the pancreas is an organ that people don't speak a lot about until you have to. And so as a result of that, when something goes wrong with the pancreas, it's a very challenging situation, usually, for several reasons. Remember what I told you was stored in there. Enzymes in their primitive or pre-packaged form. We call them like pro-enzymes or pre-pro enzymes, long story. But just imagine that they are released at the wrong time, or the wrong amount of enzymes is released, or something goes wrong with the organ itself and it's damaged, so some of the enzymes leak out. Imagine the catastrophe that would result. And in fact, this often happens in serious situations such as pancreatitis, when the organ becomes inflamed for whatever reason and starts to behave abnormally. And one of the key things that it can cause is damage to the structures of the abdomen in extreme situations. And generally what will happen is it will cause a lot of pain. And that's totally understandable. What we're going to do is take a quick break. When I come back, I'm going to show you a nice point about the interplay between the gallbladder and the pancreas. We're going to talk a little bit about what happens in pancreatic cancer, and then I'm going to share some stories. If you watch to the end, you'll find out why I actually enjoy treating pancreatic cancer. Let's take a quick break.
In a world that moves too fast, it's easy to lose touch with what truly matters, your well-being. At Teshuva Wellness, we believe in a return to balance, to healing, to your best self. Our holistic approaches nurture not just your body, but also your soul. Whether you're seeking peace, energy, or a deeper connection, we're here to guide you every step of the way. Our medical experts specialize in holistic treatments for chronic diseases, ranging from autoimmune illnesses to cancer. Our treatments are safe, non-toxic, and effective. Because at Teshuva Wellness, your journey to wellness is our greatest commitment. Visit our website today at teshuvawellnessja.com or call 1-876-787-8197. That's 1-876-787-8197. Teshuva Wellness. Return to health. Return to your best self.
Yeah, so we're back. And we are going to talk a little bit now again about the interplay between the gallbladder and the pancreas. And so you can get an idea about how the two things have an interplay in disease, especially in pancreatic cancer. We're going to talk a little bit about what usually happens in pancreatic cancer. And then we're going to talk about stories that I have garnered over the years. Right? So let's go back over here to our diagram. And you'll notice, as I mentioned before, that a couple of things are happening here. Number one, you'll notice that the gallbladder and the pancreas are interconnected by virtue of the fact that they're both emptying into the same place. So that's tricky, simply because if they're both emptying into the same place, it means that, God forbid, if there is something blocking off where they empty, then that means that both organs will find it difficult to empty their contents into the intestine. That's not good. That's like a street that community that only has one way in, one way out. That's a little bit tricky if something goes wrong at the entry/exit, because then nobody can get in and nobody can get out, which is not necessarily a good idea in this particular situation. That's one. Two, what that also tells you is because the pancreas is so closely connected to the gallbladder, it also means, let's move the diagram here, that as you can see here, the pancreas is also close in relationship to the liver. And remember, this is the liver flapped upwards. So really and truly, the liver would have been flapped down over this area. And so they're even more closely related than is shown in this diagram. So all three guys, gallbladder, liver, and pancreas, are in very close proximity, very closely connected to each other, such that something going wrong with one of them, for example, cancer, is very quickly capable of affecting the other one's function simply because they're also close to each other. So something happening here could affect here. Something happening in the gallbladder could affect the liver because it's right there, or it could affect the pancreas, or it could affect even the small intestine, which we see sometimes. So it's a very tricky situation because we don't really want anything to go wrong when everything empties into the same place and everything is so closely connected. Let's go back here. And the truth is that in pancreatic cancer, many times that is exactly what happens, because the large majority of the cancers that happen are called pancreatic adenomas, long word describing the fact that it's usually the area of the pancreas affected is the exocrine area, one that's helpful with all the enzymes. And a lot of the time, these cancers will form in the worst possible place, which is right in this region. Yeah. So imagine if something forms right here. So healthy reasoners, you can watch and see clearly what's likely to happen. One is that there's a potential to squeeze this exit point here. So neither the pancreas nor the gallbladder can effectively empty. That's the first challenge we've seen there. Two is that, God forbid, if this gets too big, then it could actually squeeze a little further up as well. Or it could even start squeezing and affecting the stomach. That happens sometimes. And we didn't even go into the details of other structures that are located around here. There are arteries and nerves. Lots of stuff running in this region. So it is a very high-powered area, one that you don't want something to go wrong in. And yet, most commonly, the cancers will form in this region, what we call the head of the pancreas. And that poses a second problem, because not only is it a little bit easier for issues here to affect the other organs and the other structures, but because of that very problem, it makes it more difficult most times for the tumor, the pancreatic cancer, to be removed in the first place. Sometimes even just biopsying it, getting a small piece of it to test, also proves difficult because of its close proximity to nearby critical structures. And also we mentioned here how much of a powerhouse the pancreas is. So that's not something that you want to be poking around in unless you have a definitive plan. I am not a surgeon. I guess technically you could say that my degree is a Bachelor of Medicine and Bachelor of Surgery, but I am not a general surgeon. So I do not perform pancreatic surgeries naturally. However, I have been a part of multidisciplinary teams where we have to make decisions about caring for somebody with pancreatic cancer. And there's lots of obstacles that happen, and I'm just being very, I am filtering out a lot of it, although it's an unfiltered podcast. I'm giving you just the critical information so you don't get distracted by all the possible variations of challenges that can take place. The main issue is just that everything is centered right here. So if the cancer forms right there, we have drama. And so most of the time, we are faced with two options as a team, a medical / surgical / oncology team. What we're faced with is the issue of, in order to effectively remove the affected area and save the person's life, God's willing, we are faced with, can we cleanly do that without affecting the other organs nearby? That's one. And two, if we are not able to safely do that without affecting the other organs, is it safe to remove pieces of the other organs in order to remove what we need to remove here? And then that opens up another question, which is, having removed pieces of the other organs, for example, let's say we had to remove some of this intestine here, how do we then reconnect everything in a way that allows the patient to still have good quality of life? Very, very tricky. If the artery is affected, for example, it's very likely that we cannot do anything in that case, although, again, I'm not a surgeon, and so the surgeons watching will tell you, well, actually, yes, there's new techniques that we can use. That's fine. I'm not here to debate that, but I'm just speaking broadly here. And then the other thing to note is that if the decision is that actually this tumor is irresectable, meaning it cannot be cut out because of the problems I listed above, then if it is pressing on the duct, on the pipe that empties the gallbladder, for example, then we need to figure out how we're going to get the body to empty all of that waste. Because remember, we told you that this pipe was the outlet pipe for the liver and indirectly the gallbladder to bring out the bile. And bile is responsible for removing the toxins from the package from the bloodstream in the liver and out into the intestines to go to the toilet. So let's flip it here. So if we cannot get the bile out, then we have a backup of bile back here, and that is no bueno. So what we often have to consider, therefore, is there a way to either just wedge something in here called a stent to hold it open, and so that at least we can get good drainage while we figure out what we're going to do otherwise. And then that opens up a whole new can of worms, because you have to figure out a way to get the stent down here in the first place. Most times you have to do a special procedure where you pass a camera all the way down here and get that stent placed. There's lots of new technology that's assisting with that, and we're very grateful. But all around, the general consensus is that pancreatic cancer is a difficult one, especially because of the next point I'm going to make, which is usually pancreatic cancer, when discovered, has already advanced pretty quickly. And as a result of that, generally speaking, the outlook or the life expectancy for some of the pancreatic cancer is usually very poor. And it's measured usually in weeks to months at best by conventional standards. And as a result of that, pancreatic cancer is one of those that is considered to be a very dangerous one. And if by now you haven't figured that out, then I think you're just pretending, because I've given you all the reasons why it's a challenge, and you can infer that it's going to be a problem just in general. So let's talk a little bit then about why would Dr. Andre like treating pancreatic cancer. I'm going to save the stories for last, but the very reasons that we've spoken about are exactly why I enjoy treating it. One, the pancreas is a powerhouse organ. It's full of vitality. It's I almost want to use the word explosive to describe its functions and how much contribution it makes to the body. And as a result of that, if we are able to support the function of the pancreas despite there being pancreatic cancer, then I'm going to just speak plainly. What it does is it opens up a lot of power to us. We actually have the potential of freeing up some power to get the pancreas to assist us in its own recovery, so to speak. So I want you to stick with me. The second thing is, by virtue of the very fact that pancreatic cancer often cannot be corrected surgically, or it's usually a tricky path to follow, the patients with this disease usually, I mentioned it last week, usually are very decisive and very pragmatic about their reality. Meaning, if somebody tells you that, hey, this organ in the middle of your belly, it's giving trouble, we believe there's cancer there, or we've tested it and we've proven that there's cancer there, then your question is going to be, well, doc, how long do I have, etc. And somebody's going to tell you at some point, well, it's going to be a few months at best. And that's very sobering. It's not something that I practice saying to patients to begin with, but the fact is that scientists scientific information, and so I have no problem necessarily with somebody advising the patient of that. So by the time the patient has decided to speak with me or another oncologist, they're pretty clear on whether they actually want to do something about what's going on, or maybe they don't. And my purpose is to support the patient regardless of what they choose, and to help them to make the best choices based on their desires. So if somebody says to me, that based on what I've heard, I actually don't want to try anything, that's fine. But if somebody says to me, well, doc, I've heard everything that I need to hear, and I want to try to help my body to heal, I want you to give me some options to help me to try and heal. And I say, well, sure. Let's look at the case and let's see how we can work together. So the first thing is that the first thing I mentioned is that the organ is powerful to begin with. So if we can help to unlock some of its power, even if it's a small amount, then it begins to work along with us. Is that the patients generally are very decisive in terms of what they want and what they don't want. 3 is that my observation, remember now, my story is that I was an oncologist, conventional oncologist at first, a hematologist oncologist at first, giving chemotherapy, recommending radiation for cancer, and all the various therapies that went along with that. I won an award, as you all know, got exposed to the naturopathic side of treating cancer, and now I practice integrative oncology, where we choose the best of both worlds to help the patient. In my experience, when patients were offered chemotherapy for pancreatic cancer, my experience generally was that the patient was badly debilitated by the experience. I'm just going to speak very plainly. I want to let you know that I don't have anything against chemotherapy necessarily, but I am sharing my thoughts on what happens in this particular situation. And so what happened was, in many cases, the treatment that was given had the intention of destroying the bad pancreatic cancer cells, usually in this region. But remember, I told you that a lot of the time, the detoxification of the body was affected. So that's a problem. And also remember, I told you that this organ is a powerhouse. So if anything, we want to find a way to help the organ to be freed up so it can give some power to us, to assist us in the healing process. So to just give chemo actually caused the pancreas to not want to work with us, as if it had a mind. And as a result of that, a lot of the times the patients were just very, very debilitated by the experience. And I want to take a moment quickly to remind you of the 4 features of a good cancer treatment protocol. I probably don't have to say it too many times. But number 1 is that we want to have a powerful cancer cell destroying tool. It's a tool that will destroy cancer cells. 2 is that we must have nutrition to facilitate repair. 3 is that we must have detoxification to ensure that the waste generated by the destruction of cancer cells and the repair and everything is taken away out here and out into the toilet. And of course, 4 is spiritual and emotional work, which is also very important. Stick around for the stories, they're coming. So, let's take this thing home now. Healthy Reasoners, we've done episode 31, and now I think we're at 32. I hope I'm right. And you have figured out by now, I'm sure, the importance of this little area here. This little area here is crucial. Because if we need 4 things for a good cancer treatment protocol, and number 3 is detoxification, then we cannot afford under any circumstances to have our main pathway for detoxification, our main outlet for detoxification blocked, whether partially or totally. Totally is even worse. So what that tells me then is that with this organ, we have the potential to directly influence the adequacy of detoxification of somebody with pancreatic cancer by helping to assist with drainage at this point, or however we assist. It's tricky, but it's helpful regardless of the way that the surgical team helps me or the radiology team. If we can get this stented, if we can get this, whatever the case may be, to assist with drainage, and we are assisting with detoxification. That's 1. And 2, listen to the beauty of this now. There is a theory called the trophoblastic theory, which was, it's about 2 centuries old now, actually. And it's brought to light very forcefully by Dr. Gonzalez, the founder of the Gonzalez Protocol. And it was based on the observations of Dr. John Beard. And you can go back to my discussion on the Gonzalez Protocol several episodes back, and you can hear the details. But suffice it to say that pancreatic enzymes, based on the research of Dr. Beard and several others, were thought to be the key off signal for telling the placental cells, trophoblasts of the maternal placenta or afterbirth, when to stop dividing and invading. And I went through details on this before, but basically these scientists observed that those cells of the placenta behaved very similarly to cancer cells. And so the thinking was, can these pancreatic enzymes at high doses actually create an off signal for cancer cells? And the suggestion is that that's exactly what happens. The pancreatic enzymes are critical for instructing the cancer cells to stop with the aggressive multiplication, and that's common to all cancers, not specifically pancreatic cancer. But look at how exciting it is, because we now have the potential to work with an organ, and we have a powerful cancer cell disrupting tool here, which is pancreatic enzymes. And at the same time, what we have is an organ that can potentially assist us. Once we've cleared enough space, so to speak, we have an organ that can potentially assist us with its own healing. How cool is that? So all of this sounds good in theory, and you can say to me, well, how do I know that this is even something that has worked well? You can look at Dr. Gonzalez's work. Conquering Cancer Volume 1 has about 50 cases of breast and pancreatic cancer successfully treated. And I can now share some of my most impactful stories treating pancreatic cancer myself. And so you can get an idea for what the experience is like on the ground. So listen to this what do you call it, commercial break, and then we'll be right back for stories and a final wrap up.
Healthy Reasoners. You asked and we listened. After enjoying today's episode, you can now send Dr. Andre your comments via WhatsApp. That's right, WhatsApp your comments or voice messages to us at 1-876-405-7831. In fact, take a moment to send us a WhatsApp right now. If it's really good, Dr. Andre will read it in the next episode. Once again, that's 1-876-405-7831. Send us your message now. We can't wait to hear from you.
And we're back. So story time. And story time is gonna be nice because I already shared with you my observation about what happened when I treated patients with chemotherapy in my former life. And I told you it wasn't a nice experience simply because the patients they became so weak, and oftentimes they weren't detoxing well. It was pretty obvious. Loss of weight, and just a really unpleasant experience for both myself and the patient. Many times the area that I pointed out here would get blocked, and that's not cool. So I want to share with you one of my first experiences after I had left my hospital life. My first experiences with pancreatic cancer. And the very first one I can remember several years ago was very, very meaningful to me. I got a call one day to say that there was a lady who was vacationing in the States, and whilst they developed terrible abdominal pain, was rushed to the hospital. Very, very well-known and reputable, well-renowned hospital in the States. And whilst there, the same exact thing that we just discussed happened, they did the various imaging studies and found that this patient had a mass, a swelling in the head of the pancreas. And so, of course, the thinking is this is probably pancreatic cancer. And if memory serves me right, they opened her up and attempted to see what they could remove. But this was unsuccessful, and so they had to simply close her back up. And I believe, if memory serves me right, they took a small piece while they had her on the operating table just to confirm that this was indeed pancreatic cancer. And the discussion was had with her that, hey, based on what we're seeing, there's little or nothing we can do. The recommendation is to consider just returning to Jamaica for, just your last couple of weeks. Yeah. So I got a phone call. Hey, Dr. Williams, can you assist this lady? She's still in the States and she wants to fly back, but only if you can assist her. And by this time I had been exposed to the Gerson therapy. And so I had a framework that I was working with that was helpful with some of the learning that I just shared with you. Had that not been the case, I would have said to her, well, boy, I don't know what to do. I'm sorry. But I had just this thought in my mind that I could help her. I'd also done a lot of training in ozone therapy by this time, and I felt confident that I would at least be able to apply the 4 tools of a good cancer treatment protocol, and you know what those are. So I said, yes, come on down. And I designed for her I think at the time it was like a 6-week or maybe 8-week protocol. It's quite some time back. And I said, hey, you're going to come see me 2 times a week. We're going to do something called a coffee enema to help to detoxify the liver. We're going to do ozone therapy to help to support the pancreas and to help to destroy some of those cancer cells. We're going to add some IV vitamins of a specific type in order to support in terms of nutrition and repair. And naturally, I encourage my patient, as I almost always do, to ensure that they sought and got good professional, emotional, and spiritual counseling. And the truth is, this was my first time applying my own principles or my own thoughts to the treatment of pancreatic cancer other than what I used to do in the in the hospital days. And I thought to myself, well, doctors have already told her there's nothing that can help her. And she's willing to do the treatment. I tell her these patients are decisive, so let's go. And that we did. She came faithfully twice a week for about 3 or 4 weeks. And then out of the blue, I got a call one night to say that she was rushed to the hospital. And I said, oh man, this is not good. So when I was speaking with the doctor at the hospital, I said, hey, I'm going to come and review the patient, but in the meantime, could you please just order a basic ultrasound image for me so I can see what the mass looks like now. At this time, the patient was vomiting and she was feeling really terrible and she was quite dehydrated. The doctor told me, so I said, all right, let's do what we need to do to support her, some fluids, etc. Let's see where we land. And so the next morning, I very reluctantly, drove very slowly out to the hospital, dreading what I would find. Walked into the area where the patient was being housed and took up the chart to start going through. Flipped open the ultrasound report and my jaw dropped open because what I actually saw there was that this patient, the mass had decreased in size by about 40 or 50%. Meaning, if it was 10 inches big, that's random figures, it was now 5 inches big in terms of diameter. And that was something that I had never seen happen before. It was something that I didn't know was even possible. And to make it even more exciting, it was something that I had been able to achieve just based on combining the principles that we're discussing right here. I don't want to go into too much details about how that case progressed. But suffice it to say, it was well documented that the patient had improved significantly. And unfortunately, the patient then opted, for whatever reason, not to pursue the rest of the treatments. So that was my first experience. And in terms of local experiences, I just jumped to another one that I had with a gentleman who had already been treated with radiation. So the doctors had offered him radiation to the ear because, again, in his case, the pancreatic mass could not be surgically removed. And so they offered him some radiation and they also offered him chemotherapy, but he was not willing to accept the chemotherapy. We met and discussed. Another gentleman who was living overseas. We met on Zoom, discussed the case. I said, hey, I think I can help you. This is what I'm proposing we do for you. And I modeled another protocol for him based off my experiences with that lady in the past and several other patients with cancer since then. And he came to Jamaica. When he walked into the room the first time, we both were very, very concerned about how weak he was, how sick he appeared, and just how much of a struggle it was just to walk into the office. But we were both committed. As I said, these patients are very decisive. We were both committed to getting this thing sorted. And that is exactly what we did. He started the protocol. We did the coffee enemas, IV vitamins, the ozone. And within 2 weeks, this gentleman was, I kid you not, he had transformed into what anybody around him would say was a picture of health. And neither of us could believe it because, he had walked in the very first consultation I did with him. He walked in with a walking stick. And 2 weeks later, he walked in without it. He told me that he was walking up and down Montego Bay with no difficulty, walking up flights of stairs on his own. His appetite had returned. He was putting on weight. Very interesting experience. Both of these patients exceeded expectations. simply based on quality of life alone and what they were able to achieve in that small space of time. And both of them also exceeded what was expected in terms of survival time. But I will be honest that what is still beating me with treating pancreatic cancer is getting patients to be diligent with the protocol, first of all, and also with the emotional work. Because remember, this pancreas is a very powerful organ. I'm going to bring Deewitika back to help us talk about the emotions and how crucial they are. But where there is a powerful organ, then it means that healing also comes with a lot of emotional work that needs to be done, a lot of emotional stuff brought to the surface, a lot of emotional repair that is needed. And so pulling everything together with pancreatic cancer, when it works really well, it works really, really well. But when the patient, for whatever reason, is not able to follow through thereafter, then it becomes a challenge. Nonetheless, these patients far outlive the conventional expectations. And so I remain optimistic about what we're going to be able to do with the right patients. So, separate and apart from all of that, the Gonzalez protocol itself has been shown multiple times to be helpful with pancreatic cancer. And you can read endless case studies that Dr. Gonzalez has published. And you can also read a lot about his medical career and the work that he did. Since that time, I have been able to review cases that are current cases since the past couple of years that are treated on the Gonzalez protocol. And I can think of one in particular, an elderly gentleman who lived for approximately 18 months following diagnosis, which is about 3 times as much as is expected. And unfortunately, again, trying to get patients to maintain the protocol, because oftentimes when they start to feel better and they realize that they have exceeded the expectations, for whatever reason, the compliance doesn't remain and the patient doesn't keep up with what they're supposed to do. Nonetheless, I want to let you know that pancreatic cancer can be treated successfully. It has been treated successfully. And I enjoy helping patients who have this disease because I am committed to ensuring that at least the next generation of our world is able to look at pancreatic cancer and say this is something that can be overcome. I know I'm going to generate some questions this week, and maybe I've gone on too long, maybe I've gone on just long enough. Let me know in the comments. I remember if you're watching on YouTube, you already know that this is video. But if you're on Spotify, this is also a video episode, so you should watch it accordingly. If you're listening on another platform, I appreciate. Please share this episode with a friend so that we don't know who you may impact by sharing this information. I don't know who I may impact. I'm just sharing it because I want the world to have this info. I want to inspire somebody somewhere to know what's possible. And I think we're going to call it a day. My next episode, I think I'm going to try and get a wonderful lady by the name of Deewitika to come back in studio here physically, but we'll get her within this episode. We'll see if we can get her to share a little bit about the emotions, especially in the context of cancer. So I'll see you guys next week for episode 33. We are really clocking them out, and I'm excited about that. Thank you for joining me this week.
Thank you for listening to another episode of the Healthy Reasonings podcast. Remember to subscribe to this podcast so you can be updated as soon as new episodes are ready. If you have a question, send us a voice note on WhatsApp or a WhatsApp message. The WhatsApp number is 1-876-405-7831. For more information or to become a sponsor, please email wellnessdocjamaica@gmail.com. See you soon.